Hello, everyone, and thanks for your attendance. Today, I will be doing a presentation, and the title is Cultural Issues in Psychotherapy for Native Americans. First, we'll start with the question, why are cultural issues important in psychotherapy overall? Well, first of all, understanding cultural content. With this particular topic, cultural beliefs shape individuals' perceptions of mental health as well as therapy. With cultural competence, it is essential for therapists to effectively engage with clients from diverse backgrounds. When considering the impact on outcomes, cultural issues can influence treatment adherence, satisfaction, and also overall mental health outcomes. The next topic is cultural issues surrounding processing of trauma for Native Americans. With historical trauma, the concept of historical trauma refers to the cumulative emotional and psychological wounds passed through generations due to events such as colonization, land dispossessions, and forced assimilation. With Native Americans, they may often experience PTSD-like symptoms which stem from collective historical injustices that affect their mental health. With spiritual beliefs, traditional healing practices often incorporate spirituality and connection to nature, which can provide a framework for them to understand and process their trauma. Therapists must be open to integrating traditional rituals as well as ceremonies such as sweet lodges and talking circles into their treatment plans. For issues that surround the processing of trauma for Native Americans, of course, there's stigma. Mental health stigma can prevent individuals from seeking help, which often leads to a reliance on substances or even isolation. It is important to address stigma within the community because it is essential for fostering an environment where seeking help is normalized. Collectivism versus individualism. Many Native cultures prioritize collective well being over individual success, which influences how trauma is processed and treated. Group therapy and community-based interventions may be more effective than traditional individual therapy models, and this is very important for therapists to consider. Next, we'll be talking about factors that impact access, engagement, and the use of psychotherapy after trauma for Native Americans. When discussing social factors, family and community dynamics play a significant role in seeking help. Involvement of family members in therapy may be essential for healing. With cultural traditions, many Native Americans may prefer traditional healing practices, such as ceremonies, herbal medicine, over Western psychotherapy due to cultural familiarity. With economic barriers, limited access to healthcare resources, and funding for mental health services in many reservations. And there are also language barriers. And it is important for language accessibility in therapeutic settings to facilitate communication and trust. And in this case, a lot of the communities, a lot of these facilities and hospitals do need to have translators available to patients, whether they're on hand, by phone, or someone just to be with them throughout the shift. And this is just some additional information. With community-based approaches, it is important to integrate traditional healing methods with evidence-based psychotherapy. This can enhance treatment acceptance as well as effectiveness. When it comes to the training of therapists, of course, that's very significant, as cultural competence training should be mandated for mental health professionals working with Native American populations as well as any other populations of patients. With any type of nursing, any type of healthcare field, anything in medical at all, it's always important to build trust. Because establishing trust is critical for engagement, and therapists should approach clients with humility and respect for their experiences. In conclusion, the engagement of Native Americans in psychotherapy following trauma is significantly influenced by a variety of cultural issues. Some of these include historical trauma, spiritual beliefs, and communal dynamics. Understanding these factors is vital for mental health professionals seeking to provide effective care. Culturally competent approaches that honor traditional healing practices while integrating modern therapeutic techniques can enhance access and engagement in psychotherapy. Overall, acknowledging and incorporating the unique cultural content of Native Americans into mental health care is essential for facilitating successful therapeutic outcomes and ensuring that individuals feel seen, heard, and understood in their healing journeys. Thank you.